starts now.
It's been 3 months since the salary of the CEO of Valley Children's Hospital came to light. The amount of his total compensation caused shock, even outrage, among many in the community. Tonight we have his response to the revelations. And thanks for joining us tonight for Action News. I'm Warren Armstrong.
And good evening, I'm Margot Kim. Todd Suntrapak's salary even led 2 Fresno City Council members to call for a state investigation.
Action News anchor Graciela Moreno sat down for an exclusive interview with the CEO. She joins us now with what Suntrapak had to say about the controversial compensation. Graciela?
Well, this is the first time we hear from Todd Suntrapak since the public learned details of what many would consider an extremely generous compensation package when compared to other hospital CEOs. Now, we met with Suntrapak after being told by the hospital that he was ready to address the issue. We asked not just about his salary, but that of his executive team. We asked where the money comes from and what he wants you to know about how donations to the hospital are spent.
How the salary of Valley Children's CEO Todd Suntrapak compares to other regional hospital systems.
New numbers are shedding light on how it stacks up to other California hospitals.
Various media reports first shed light on the now controversial compensation of Valley Children's CEO Todd Suntrapak back in March. Tax documents revealed that his total pay more than doubled from $2.1 million in 2019 to $5.5 million in 2020, the first year of the pandemic. We sat down with Suntrapak for an interview addressing the criticism swirling around his compensation. So the question is that your pay more than doubled from 2019 to 2020. Why?
I'll start by saying I'm really proud of this team, and I'm really proud of the work that we've done, and I'm proud of the work that I've done as the CEO and the leader. And I don't choose what my compensation is. Our board determines what the appropriate compensation for the CEO is, and they rely upon external experts to advise them and to do quite a bit of analysis, and then they make a determination.
The following year, in 2021, Suntrapak earned $5.1 million in total compensation, which included $1.7 million in base pay. Suntrapak says he received 2 bonuses that year, totaling $3.4 million due to a change in the hospital's bonus schedule. Suntrapak also received a hefty incentive that year, a $5 million forgivable loan, which he used to purchase a $6.5 million home in Carmel.
There is a portion of the loan that is forgiven each year, which I'm taxed on, shows up in my W-2 income, and the term was 10 years. So again, the intent of the board was based on their assessment of my work, was wanting to retain me for that period of time. And this was a tool that was available to them.
Does it not feel excessive to you?
Again, I'm proud of the work I've done here. Got Graciela for close to 30 years. And that is really, my compensation is not something I choose. That's the purview of the board. And they use external consultants to advise them on this work, and then they make those decisions. It's not really for me to say.
IRS forms also revealed the CEOs of 13 other larger children's hospitals across the country made considerably less than Suntrapak in 2021. One example, the CEO of Children's Hospital Los Angeles, ranked 11th by bed space, earned $1.7 million, while the CEO of 16th ranked Valley Children's earned $5.1 million that same year.
It's difficult to know who you're comparing versus which peer group our board used to make their assessment. And I think importantly, what we have created at Valley Children's, starting with quality. We are in the top 3% of children's hospitals in the country, as recognized by the Leapfrog Group, which is a national enterprise focused on assessing quality and patient safety.
The hospital's executive team's pay has also been under scrutiny. In 2019, the 5 top-paid executives combined made close to $4.3 million. In 2020, the combined compensation of the 5 top earners totaled more than $9.9 million. Suntrapak again highlights the quality and scope of care at Valley Children's.
The hospital label is a little limiting to begin with. When we talk about compensation of our executive team, we provide care in 12 different counties. We have multiple outpatient locations, campuses. We also oversee and operate pediatrics in 9 other acute care facilities. Sometimes we have licensed those beds, and sometimes that's at a partner's location.
Suntrapak also came under fire by 2 Fresno City Council members. Gary Bredefeld and Miguel Arias have questioned whether money from public health care reimbursements like Medi-Cal was used to fund executive salaries.
I don't agree with that statement, no. We certainly have commercial insurance that we charge for the services we provide, as well as investment income. I'm not aware that we've ever pinned any type of employee's compensation to a particular revenue stream.
The council members are pushing for a state investigation.
We know that Valley Children's is a jewel, but what they've done is violated the public trust, and there needs to be accountability and transparency.
We asked Suntrapak if this issue has changed the public perception and the support for Valley Children's.
Do you feel that any of the trust that the community had in this hospital has been lost?
I have heard some people, again, anecdotal information. I've heard it directly. And I've heard more that have said we have every amount of trust in Valley Children's that we ever have. So different people are entitled to different opinions.
Many in the community have expressed their opinions on the matter via social media, some in support of Suntrapak and the hospital, but others expressing disappointment, even accusing Valley Children's of using donations to pay top hospital salaries.
We're always thankful for the investments that are made by the public in the work we do at Valley Children's, which is really about helping kids. And as I said, most of those donations are restricted. If there are any concerns in the future that a donor may have, they simply need to restrict that contribution, that gift, that investment.
According to the hospital, the annual Kids Day fundraiser sponsored by ABC 30 generated $480,000 this year in restricted donations to be used by the hematology department. The hospital's 15-year partnership with Panda Express has raised $5.3 million, money that's restricted to patient support programs. And while the hospital prides itself in its overall handling of the pandemic, including no staff layoffs, furloughs, or pay freezes, we have heard from Valley Children's nurses who say their compensation has not measured up to that of nurses at other local hospitals.
If the hospital is doing such extraordinary work, why aren't they being compensated equally or more so the way that this executive team is?
So I think nursing wages in particular are very fluid. We recently made an adjustment to our nursing salaries that puts our nursing salaries on par with anybody else in the area.
Despite the public outcry over compensations, Suntrapak praises the work of his team and says everyone at the hospital plays a role in ensuring Valley kids have access to the quality care they deserve.
I would not trade the team at Valley Children's, stem to stern, for any other team in pediatric healthcare in the country.
Well, we requested the latest compensation information for Valley Children's CEO Todd Suntrapak's tax forms are not yet publicly available for calendar years 2022 and 2023, but according to numbers provided by the hospital for 2022, Suntrapak was paid just over $3 million in total compensation, about $1.7 million in base pay, a $1 million bonus, and $310,000 in health and retirement benefits. We'll continue following this story.